You can't see this, but the timer screen is not working, so I'll take that as a sign that I can speak forever. Oh no, it started working. Damn. So 25 minutes to talk to the World Congress on Public Health. It's an opportunity that I take very, very seriously. Add to this the layer of going last in an incredible lineup and sitting sort of through particularly Bronwyn's presentation just now, and thinking, what can I add to this morning, to this journey for all of you, that maybe is the sugar-free icing on the cake that is the morning plenary. So I'm going to talk about food and the fact that it's in some ways the closest thing we have to a silver bullet for the major challenges facing our global community, but also that it's fast becoming a source of major morbidity and mortality. I'm not going to compete with the great speakers on tobacco and talk about whether my risk is bigger than their risk, but I am going to add to the mix that you've heard so far some common elements and some new ideas that hopefully will help you be more effective public health advocates, policymakers and change makers. So we all know the adage, you are what you eat, and in very many ways, it's absolutely true. Whether it's over the last handful of millennia or whether it's over the last century and a half, food has had a huge impact on the health of our societies. In fact, the changes that we've seen in humans as we've evolved over the last 50,000, 20,000, 1,000 years has very much come down to changes in the food that we're eating. It's allowed us to grow bigger brains, it's allowed us to do more complex tasks. It's allowed us to move out of the caves. And of course, it's allowed us to be taller, more handsome, and more effective communicators, hopefully, we'll see. But in the last 100 years, we've also seen some major gains. In fact, since 1900, the global average life expectancy has more than doubled. And in part, this has been down to, in a big part, this has been down to the food that we have been able to eat. The proportion of people who are hungry on the planet today has halved since 1969 alone. That's a great story for global health, and we should pat ourselves on the back for the small part that public health played in that change. And food has led to incremental intergenerational gains in height, in life expectancy, in quality of life. And this has largely come through changes and improvements in food security, in the quantity of food that we have access to and we're able to produce as a planet, and most importantly, the quality of that food. And lastly, if you're a hipster in the audience, particularly living in the northern suburbs of Melbourne, maybe the best reflection of the fact that we are what we eat is the number of photos we take on Instagram. In fact, the most photographed objects on Instagram again and again are the food that we eat. And this shows that food is not just a part of our bodies, a part of our health, but it's also part of our culture. It's something we love, it's something we connect with, it's very emotive, and something that brings us all very often around one table, literally and figuratively. So how has something that helped us so much to make gains in the last century become a major challenge to global health today? Because, and again, Professor Jas sort of said that epidemiologists love numbers. The other facet of that is that epidemiologists can reshuffle the numbers in all different ways. But this is still an important representation of the global burden of disease. And what this shows us is disability-adjusted life years and the rankings for different risk factors. And what it shows us very clearly is that, in fact, dietary risk, poor diet, has become the number one risk for morbidity and mortality, years of life lost from the life expectancy, and years of life lived with disability around the world, men and women alike. At the same time, almost 2 billion people on this planet are now overweight or obese, whilst 800 million approximately wake up hungry every morning. 50 million children continue to be wasted, that is, acutely undernourished, whilst almost the same number, 42 million and rising, are now overweight or obese. So we have this strange combination of overweight, obesity and NCDs and undernutrition, unrelenting undernutrition, the so-called double burden of malnutrition. But food and the challenges posed by food go much, much further. In fact, by some accounts, our food systems are the single largest driver of greenhouse-related gases on the planet today, more than all land, sea and air transport combined. And if we were to just add up the food that we waste and make that a country, it would be the third largest emitter of global greenhouse gases on the planet, after China and the United States. So last century, we were making great gains in global health from a food perspective. And the major challenges facing the global community were challenges like this. Instead, the vectors of disease today look very, very different. These vectors are active, they're not passive things in our environment. Mosquitoes didn't mount big advertising campaigns that brought us summer, brought us Joyville, and brought us happiness. And mosquitoes certainly didn't have very well organised, very well funded lobby groups that sued our governments when we handed out bed nets. If we look just at Australia and one major multinational hamburger corporation, I won't say which one, last year alone this organisation, and Australia is one of their most profitable markets in the world, last year this corporation alone made $5 billion in the Australian market. Now if you do the maths, that's about $200 for every man, woman and child in Australia. Now I'm assuming you guys didn't spend $200 at this one fast food giant, and neither did I. So some people are spending much, much more. We also know that there are around 2.5 times more junk food restaurants for every per square kilometre. The highest concentrations are in our poorest neighbourhoods nationally, and in particular in our poorest neighbourhoods around primary schools and high schools. The World Health Organization, where I'm based, we've brought out clear guidelines recommending that adults make sure they keep their free sugar intake as a proportion of their total calories each day down below 10% and even 5% if you can manage it, particularly for dental reasons. So we recommend 5% as the sort of best recommendation around free sugars. When you then compare this, a single serve 600 ml bottle has around 3 times, more than 3 times, the average sugar that we would be recommending for a healthy adult male. How many times have we seen younger people, or people that are definitely not as big as an average healthy male, enjoying a so-called single serve of soft drink? We have 570 smallholder farmers on the planet, but increasingly this is what our food system looks like globally. Commodified, we've made it into something that makes profit rather than health. Homogenized, it looks the same no matter where you go on the planet. Globalized, as we've become globalized, so have our food systems. And in many ways, so-called westernized, the Western diets that we saw build momentum through the middle of last century and now moving to all the corners of the globe. So there are some big health challenges that we've talked about today and we're going to hear about throughout the week. And what you're now realising is that underpinning many of these major health challenges is in fact our food. Now we need to put this in the context obviously of globalisation, of urbanisation. More people live in cities today than ever before, in fact more than 50% of the planet for the first time in history. And for demographic changes, people are getting old, that also affects what people die from. But with the small amount of time I have to talk to you about today, I'm actually going to focus in on the commercial determinants of health, and something that Alona picked up on yesterday and that Bronwyn mentioned before. A really important concept that very often we're not taught in public health, and if we are, we're overlooking and we're not using as a way of moving the agenda of tobacco, alcohol, and in my case, food and obesity forward. It's the concept of a negative externality, and I'm sorry to get really nerdy with you for a moment. I'm not an economist, so I apologise for those in the room that are. I'm going to simplify things right down. A negative externality is the idea that I make something and I cause some damage in the process, but someone else pays for that and I enjoy the profits only from the product or the service that I provide. Now, this is what our markets tend to look like. Again, this is the Sandro diagram. I apologise to the economists. We have a producer, that's the company. We have the population, that's us. Let's not use the word consumer. We have demand, so how much of the product does the public want? We have supply, how much is being made? We have the revenue, which is the price or the income. And we have the costs. How much does it cost to make the product? But really importantly, we have the indirect costs. What costs does that product have on society outside of the $3 we pay at the checkout? And that is the key to the problem of obesity and many of the problems that we're talking about today, and something that we have to work together to solve. I'll explain more now. So that's what a market looks like. Now let's look and apply that to soft drinks. We know that soft drinks are associated, consumption of soft drinks are associated with obesity, they're associated with diabetes. We know there's a clear gradient, social gradient of consumption. Poorer household neighbourhoods and families in Australia drink more soft drink. We know from a recent survey of teenagers that 1 in 2 had consumed soft drink the day prior to being interviewed. And we know that Australians drink somewhere around 100 litres of soft drink each and every year. So why is that in the context of something that causes, or that is highly associated, and we can argue around causality of these health outcomes? Well, the first really important step is where the number one is. So to make soft drink is very, very cheap. For the producer, it's aluminium, very cheap. Water, sugar, and the magic recipe that none of us know. Very cheap to make, but people are willing to pay a fairly good price for 3 things, one of which runs from the tap, one of which is a very, very cheap commodity, sugar, or we can make it sometimes even cheaper by stripping down corn, and one of which we pull out of the earth in large quantities. So the product is sold and the revenue is kept by the producer. The problem arises through the indirect costs, because the indirect costs associated with producing or consuming soft drink are not borne by the vendor or by the company making them. The health costs, the environmental costs, and even to recycle the can or to pick up the can or to make sure that we're not ending up with the trash associated with consumption all over our cities, none of those costs are picked up by the manufacturer, by the company that produces it. They just take the profits at sale. So those costs are pushed back onto the population, and these are therefore externalised. Now, what effect this has is that these costs grow and they're pushed on to the consumer, the public, or the taxpayer. The revenue stays with the producer. They become more powerful. It's a very, very profitable business model. It doesn't make a lot of sense, but it's a very profitable business model. And so you've got something that's cheap to make. You don't have to pay for the fallout. And in addition, you're able to charge a good price for it. So what do? You make more of it, and more of it, and more of it. And you find new markets, and you find new consumer groups, and you move to other countries. But eventually demand becomes a problem, because you've got this growing health fallout, you've got this growing environmental fallout, and the traditional way is that the consumer would produce the demand, okay? But eventually the consumer says, you know what, I think I've had enough, or they get to a point of saturation. And this is when something really scary happens. This is step number 2. And this is when the demand moves from being driven by the consumer to being driven by the people producing the profit. And how do they do this? It's called marketing. Spending hundreds of millions of dollars, building a culture, funding our sporting events, getting into our schools, and influencing every part and way of our lives, so that we're reminded constantly to keep consuming something that we've probably had enough of in many ways. And certainly from a health perspective and an environmental perspective, we've had enough of. So possibly at some point the public awakens. I give enough, we have enough of these opportunities to come and speak to great groups of people. They go out and talk to other people. Damon Gamo does a great job with the sugar film. The public starts to wake up. And this brings then step number 4. And this is what Bronwyn talked a lot about. And this is then when the companies start to use other tactics to limit the abilities of the public or of our governments to protect us and to actually integrate those costs into the price of the product. We call it a tax, but we'll talk more about that later. So they might deflect attention, they might distract with false science or with funded science, which is dubious. They might obfuscate, or they might influence through millions of dollars spent on lobbying. And what's left is a population that is being heavily influenced by the commercial determinants, that is being heavily marketed to from a very young age. We know as early as 1-year-olds can link marketing with a product. So we're building a culture of consuming a certain product from the earliest ages. And we're left with a population that is not only being, I would say, certainly influenced heavily by the wrong drivers, for the wrong drivers, but also with a massive indirect cost and fallout to health, also to our environment and to our communities at large. So it means in the end that the 99-cent can of soda doesn't actually cost 99 cents to our community. And this is really important for us to understand, because there are actually 3 prices that we pay, at least 3 prices that we pay when we buy a can of soda. And this is just one example. You could apply this to any junk food, but soda's a little simpler. So there's the price you knowingly pay at the checkout, 99 cents. There's the price you pay later through health and other fallout. And then there's the price that we all pay later, and the latter two we're not aware of and we never talk about unless we're talking about a sugar tax or a sugary drinks tax or a sin tax, and we'll talk again more about that in a moment. And yet we're told that this is a free, fair and transparent market. Now to me this just doesn't add up. We're paying one price, we're being told we're paying one price, we're paying 3 prices, 2 of which we're not really aware of, most in the population are not aware of, and we're being told that we want to protect and maintain a free, fair and transparent market. So what are some of these externalities? And certainly I'm not suggesting that soda has caused all of these, but it's a contributor. Food is a major contributor, as we've already said. We know that, and I sort of use Australia, again, apologise for the international participants. I use as Australia as an example because otherwise we're trying to cover so much. I want to give you a level of specificity. Australia is expected to experience an additional $87.7 billion in indirect costs from obesity over the next 10 years if nothing further is done about the growing epidemic. At the micro level, the average annual healthcare costs per person with diabetes is around $4,000 a year. And NCDs, diabetes, heart disease, cancer and lung diseases, many of which are heavily linked to what we eat, as well as the risk factors we've already talked about, including diet-related NCDs, now cause 91% of all deaths in Australia, 18% of all GP visits, and 30% of total health expenditure. So these externalities are not small, they're enormous. So finally, let's move, what are the solutions? Well, certainly a big part of the solution is moving populations, finding ways of moving populations to healthier, more sustainable diets. The WHO recommends diets that are based on fresh fruits, vegetables, legumes, nuts and whole grains. the 5 portions of fruit and vegetables every day, clear recommendations that people can understand, utilise and integrate into their life each day of less than 10% of total calories from added sugars, fats, and then limiting salt. This is really important. We need to have something to aim for at the individual level. In addition to this, in 2016, and something that I've been heavily working on with the team back in Geneva and also Rome, is the new United Nations Decade of Action on Nutrition. So we're taking those principles and then looking at how we actually implement those across populations. And it's really about rebuilding our food systems so that they're resilient, sustainable, and matching not just the issue of food quantity and production, which was the focus of last century, but equity and quality, which is going to have to be the focus for the next century. It's about also making sure that our health systems are responding appropriately to the challenges, the public health challenges that we're facing. Social protection and education is key. Trade and investment we've already talked about, but in many ways we need more economists, more lawyers in public health and less doctors like me. I strongly believe that. Trade and investment is a major source of challenge for global health, and it's only going to get more complicated and more important. Obviously, safe and effective environments for nutrition at all ages, including the protection and promotion of breastfeeding and the strengthened nutrition governance and accountability that we have been talking about already today. But coming back to this diagram and those various stages at which the economic foundations of our society are failing us and failing our ability to protect and maintain public health, we need to also be addressing these different areas. We need to be using appropriate legislative tools to give producers clear and compulsory limitations on what is appropriate and what is not appropriate behaviour. Oh, I've gone forward. I mean back. There we go. We need to also address the issue of demand, and particularly demand that is induced by the producers of products that we know cause harm to our public. And most importantly, at the core of all of this, we need to address the issue of externalising the costs of the food and of the tobacco and of the alcohol that is causing so much damage in our societies. And this is what the model should look like, and hopefully will look like in 10 or 15 years' time. And of course, this comes down not to individual choice and not to telling people simply eat this, don't eat that. It's not about shaming and blaming, and it's certainly not about pointing the finger at parents or at individuals. But it must be born, action must be born in policy and in careful, appropriate, progressive policy. I'm just going to touch on 3 with a minute and a half to go. So the first is the so-called syntax. If you take nothing else away from my presentation today, please never, ever, ever use the term syntax. If there are 2 things that the public hate more, if there are 2 words that the public hate more, and if there are 2 words that could not be worse representation of what we're actually talking about, having now seen the diagrams that I showed you, they are a sin and a tax. No one is sinning by having a soft drink, and we shouldn't be giving the impression that we think they are. But more importantly, we're not talking about a tax. We're not talking about adding a cost because we want to fund something. We're talking about building in the true cost of the product. We're talking about making companies reflect the true price of the product when people purchase it. We're talking about fair equal and transparent markets that allow people to make an informed decision about what they do and don't eat. We're talking about progressive fiscal policies or true pricing when you're speaking to the public. We're not talking about telling people what to eat or drink. Nobody likes to be told what to eat or drink, not by our parents, not by governments, and certainly not by people like me. What we're talking about is limiting induced demand through advertising. What we're talking about is stopping companies from advertising products to one-year-olds that they know will induce a very agreeable consumer for the next 50 years, but for products that we know and they know cause a health fallout. And finally, let's not get engaged in arguments about big government or free markets. At the end of the day, we're not talking about taking people's rights away. We're not talking about an Orwellian world. And we're not talking, I think we've made it pretty obvious that we're not already talking about free markets. These are not free markets. What we're talking about is public health for the most vulnerable in our societies, and being truthful to people and being fair to people and actually doing what people expect of us, of our policymakers, and also of the companies and producers of these products. So I'll close there, but just to say that food, at the core of our biggest global health challenges, sadly, is what we eat or what we don't eat. Food is powerful, food is emotive, food is something that we all do 3 times a day. It's something that doesn't yet bring shame immediately to the minds of people when we talk about it. And so it's a great way of starting a conversation on a road to achieving some of these policies, some of these outcomes that we need, not just for the food-related diseases, but more widely. So whilst food has become, for many in our society and many on our planet, a source of morbidity and mortality, food could be, and with you in the room helping us, food will be the closest thing to a silver bullet for people and our planet.